Welcome back. Today I am joined by Lima Memorial pulmonologist Dr. Jason Stienecker. He's going to talk a little bit about the fight against lung cancer through Lima Memorial, and they have some new advancements like the low-dose CT screening. So could you explain for people at home what exactly that CT screening is?
Yeah, absolutely. So low-dose CT scan has been around for a little while, and it's basically using a CAT scan of your lungs yearly to screen for lung cancer if you specifically meet the requirements. And the advancement of this is before we only used a chest X-ray, which is a two-dimensional picture of a three-dimensional person. So when we look at CAT scan, it definitively can give us more information than an X-ray can. And the advancement with low-dose CT scan, we get it at about an 80% dose reduction of radiation from a normal CT scan.
And recently the guidelines for who should be getting those scans has changed. Could you tell us who would be a candidate for one of those screenings?
Absolutely. So if you smoked at least 20 pack years, so 20 pack years means 1 pack a day for 20 years or 2 packs a day for 10 years. If you're still smoking or have quit within the last 15 years and are between the ages of 50 and 80, then we would recommend getting talking to your doctor to discuss possible risks and benefits of getting this low-dose CT scan.
And what are some of the benefits of having an LD CT lung screening?
So the benefits are it can see other diseases too, because it is a CT scan. So we can keep an eye. Obviously, most of these patients or all of these patients have at least smoked some. So we can get an eye on their lungs and see if there's how much damage there's been from smoking, if there is or isn't damage, any sort of nodules, and it allows us to catch everything early. We catch this lung cancer early, these nodules early, we can be precipitous about it and get them taken care of very quickly, which improves the chance that we can cure them and they go to continue on living a normal life.
And if somebody at home is listening and they think they might fall into one of those categories, what's the next step for them?
Yeah, absolutely. So we recommend talking to your family doctor, because anybody can order the CT, but we really need to discuss there are risks of everything we do in medicine, and there's benefits. We want to talk to you about that. So reach out to your family doctor. Our office is always available as well, but we prefer you talk to your family doctor, and if they have any questions, they always refer you on to us. And if you don't have a family doctor, reach out to Lima Memorial. We'll be able to help you get somebody that's accepting your patients.
And once they go through the doctor and they realize they are at the point where they would like a low-dose CT screening, how do they go about scheduling those?
So basically the doctor will just send the order in, and the schedulers from Lima Memorial will give them a call, schedule around your schedule itself, so we make it very easy for you. And then they tell you when to show up, where to be, and they get it taken care of for you.
All right, well, thank you so much for all of this useful information. I really appreciate it, Dr. Stienecker.
Absolutely. Thank you so much.
First Edition will be right back right after the break.